Hello. So today we're going to talk a little bit about probably some things you're very familiar with, kind of the social climate we have going on right now, and how that's impacting the Muslim community, and we'll emphasize a little bit on addiction, and we'll talk about some protective factors, culturally informed treatment, and some recommendations. So with the social climate we have right now, since the election and the long campaign season we had for over a year, we're seeing a tremendous increase in anti-Muslim incidents and Islamophobia. So with the Southern Poverty Law Center found that there were over 1,000 bias-related incidents that happened within the month after the election. So 315 of them were anti-immigrant incidents, and 112 of them were anti-Muslim. And both of those kind of overlap because a lot of Muslims are immigrants. We also saw from the FBI's hate crime statistics of how much the hate crimes went up. So we're seeing a rise of hate crime to the level we saw after 9/11. So the hate crime from 2014 to 2015 increased by about 65%. And we're seeing more and more hate groups that are coming out as specifically anti-Muslims. And we're also seeing how politicians are kind of taking advantage of this situation and incorporating a lot of the anti-bias and views into their campaigns and proposing different laws that would further marginalize the Muslim community. So we saw that with the Muslim ban that Trump proposed that he actually carried out. A lot of us were not sure if that was going to happen, but he proved us wrong. But and he went through with it, but it's been stayed, and he tried to do it again as not a Muslim thing, but we thankfully a judge stated saying that it walks like a duck, then it is the, I'm messing up the the idiom. So yeah. We also saw anti-Sharia laws that was going up since the election of Barack Obama. So we saw anti-Sharia laws in states, a lot of the southern states like Oklahoma, Tennessee, South Carolina. Even though we have the Constitution says that we cannot adhere to any foreign laws besides the laws of the U.S., but these things are coming up as a way to kind of reflect the anti-Muslim sentiments that we already see in society. So right now we're seeing a lot more specific anti-Muslim biases. Islamophobia, as you know, was first coined by the Runnymede Trust as unfounded hostility or fear of all or most Muslims. So the Southern Poverty Law Center found that there's at least 101 known anti-Muslim hate groups right now, which is a 197% increase from 2015. So that's a huge jump. And we're also seeing they also saw that there were 49 anti-Muslim hate incidents that happened within 10 days after the election. So that's very apparent of kind of the mood of the country right now. And we also saw the anti-Muslim incidents that were more kind of covered by the media. But since then, because it's happening so much, we're not really seeing it in the media as much anymore, but it's still happening. We'll know more about it after the hate crime statistics come out and there's more documentation of it. So the Pew Research Center did a survey of how people were feeling about Muslims and kind of all the things that came out of Islamic State, all the focus on that. They found that 46% of Americans thought that Islam was more likely to encourage violence, and 49% thought that Muslims are anti-American. At least some are anti-American, with 11% reporting that they think all or most Muslims are anti-immigrant. And in a similar survey taken at the same time found that 46% of Americans thought Islam was more likely than other religions to encourage violence. So we're kind of seeing the reflection of the already existing bias that was kind of promoted in the campaigns, the presidential campaigns, that is reinforcing the people who already had some of the prejudice. When a study was done by O'Connor and Jahan, they found that out of the 110 participants in their study, 18% reported that they personally experienced government surveillance. And that had a huge impact on them in terms of their health outcomes, mental health, and physical health. We also saw from Kevin Nadal and his team from a qualitative study of microaggressions that the participants experienced. So things that came up from their interviews were pathologizing Islam, being perceived as terrorists, being called names related to terrorism, perceiving Muslims as a monolithic group, so kind of thinking all Muslims are Arabs and all Arabs are Muslims, things like that, and things that we may see on TV, a lot of depiction of Muslims as terrorists, all the ISIS-related things. And then there's a small group of people who are also exoticizing Muslims. So they are perceiving it as like a positive thing of accepting Muslims, but they're using it in a very, not in a positive way for the individuals, like we see like Lady Gaga going to her concert in a burqa. So that's like a cool thing to do because she's Lady Gaga, but a person walking down the street with the burqa might be harassed and would be discriminated against. There's also Islamophobic language they're facing, and also being perceived as foreigners. So many of the Muslims they interviewed were people who were born and raised here. So I think since all of the Islamophobia started, a lot of it also existed before 9/11, but it's just gotten much bigger after 9/11. They're being perceived as not American. So suddenly you're a foreigner in your own land, places you've known forever, places you've been born and grown up in. So all of this has a huge impact on your health, so both physical and mental health. So we'll focus more on mental health right now. So some of the research we'll probably talk about has Dr. Arfkin's studies. So one of the studies found that there's a huge increase in fear and anxiety after the rise of hate crimes since 9/11. There's a lot of concerns about people's physical safety, so it's a very real fear. So because of that, people reported being more isolated, not going to places they would normally go to, maybe staying away from the masjid, feeling a loss of, like a sense of loss of community. So like people who would normally gather, and especially we've seen that like right after 9/11, like avoiding those places. And also being stigmatized as a Muslim person and being excluded from the the society as a whole when we all grieved as Americans who were being attacked with 9/11. So people who lived in New York, there were Muslims who also lost their life in 9/11. So they weren't really allowed to grieve the way the rest of the society was allowed to grieve. They were seen as the enemy who may not be affected by what happened. There's also association between religious discrimination and suspicion, and vigilance and wariness. So people who are who've experienced personal discrimination because of their religion were more likely to have extreme paranoia out of vigilance. So some suspicion and vigilance is necessary, is to be safe, especially right now. We know there are things that happen, we need to be safe, but it becomes a very unhealthy thing when it's really impacting your daily life or like isolating you from things that you used to enjoy, things you like being around your community. So we saw people who were interviewed for this survey, they reported seeing 91% of them perceived an increase in discrimination since 9/11, and 53% reported personally experiencing discrimination. So again, we saw the study showed that there's anxiety related to people who experience personal surveillance. They also exhibited more avoidant and vigilant behaviors, different forms of suppression of kind of their anxiety, so that affects mental and physical health. So a lot of times with people of color and minority communities in general, people might not express their mental anguish by saying they're feeling depressed or feeling anxious. They might express it more in their physical health, which would be like having sleep problems, having stomach issues, having back problems, things like that. Also increased anger, but it wasn't related to surveillance. So anger is something we want to be kind of aware of because it can be a positive thing. Anger can propel you to be more active as an activist, be part of social justice related activism, participate in the political process. But when the anger is often internalized or externalized with like interpersonal violence, that's when it becomes a very negative thing for the person's health. So Roberto will talk a little bit about coping.
Hi everyone again. So I'll talk a little bit about unhealthy and healthy coping skills, and some of these things Mena have talked already about. So I'll just kind of touch on it again. So some of the unhealthy coping skills would be like withdrawal. So stopping and not doing things that one enjoyed doing in the past. So extreme paranoia and vigilance, and I think Mena has talked a little about this. So some paranoia and some hypervigilance is actually healthy and is very much justified. I think it becomes a problem in an unhealthy way when it interferes with a person's daily life and daily function. So acculturative stress, and that means like stress as a result of feeling like a foreigner in one's own country, in one's own land, and especially for Muslims who are born in the United States. So internalization. So in other words, getting the negative message that one's here about oneself and actually believing that those are true and using them against oneself and other people within your group. So, for example, blaming other Muslims for you're ruining for everybody else, so to speak, because those are the messages the person has received about who they are. As a matter of fact, I would say that among people in minority group, including Muslims, this is actually one of the most dangerous things during times of oppression is actually believing negative message about oneself and acting, upon them in a negative way. So self-harm, and here we're talking specifically about things like suicidal behaviors like cutting and engaging in other, suicidal behaviors. So interpersonal violence, and this is, specifically, with those close to us, and those who we love. And if you think about it, if you go the entire day and days and week and month and years and not being able to express who you are and talk about, or defend yourself and speak up, when we get home or we're around people who we love, we kind of lash out, right, so to speak. So some other unhealthy coping, and actually Mina talked a little about this as well, that we're going to talk about was substance use as a result of depression and as a way to cope with negative, with the negative effects of someone's anti-Muslim sentiments. So one of the things that we have seen is actually an increase in substance use, in Muslim countries. So that actually has been amplified even more here in the United States. So in a study of over 10,000 Muslim American college students, the researcher found that about 46% of the students use alcohol, 25%, illicit drugs, to 37% tobacco, and gambling was, about 30% as well. They didn't find any gender differences, in drug use. And also, they reported that participants perceived their excessive drinking. They did not perceive their excessive drink as problematic, but rather normative. In other words, this is what we do, in college, in American college campuses. And the more acculturated the person was, the more likely they were to use substances, including polysubstances, which is much harder to treat. And I think there was a panel earlier about that. And so a lot of this, it is undetected because lack of assessment by health providers. In other words, therapists not asking not asking the question about substance use. And as a matter of fact, counselors already do not do a very good job in asking that question to anybody. So when we see with Muslim is even more problematic that counselors are not asking this question because they're making assumptions about religious values of Muslims. For example, they don't drink, therefore I don't have to ask that question. So here's some protective factor. Actually, some good news and things that we can cap on. So religiosity. So being connected to one's religions. So high adherence of, to values associated, with the Muslim religion and to being close to them. It can actually be a protective factor. Parental disapproval. It seems like if parents disapprove of you drinking or just substance use, the less likely you are to actually engage. And then having a positive and strong family heritage connection. So being connected to one cultural background and actually, and celebrates one cultural background. And just having, Amina talked a little bit about this, having a strong social connection. So living around other Muslims and having friends who abstain, who also abstain from drinking. So this is some of the protective factors, and Mina's going to finish us off with some culturally appropriate interventions.
So this goes goes along with some of the things Roberto talked about protective factors. So one of the things that therapists or just health providers in general can focus on is family cohesion. So when there is a stronger family connection, families are more together, there is less likely to they provide more support to each other, and that can also help in kind of combating some of the substance abuse and mental health issues. So working on, so if there are like young people, children or youth, working on the problem as a family can also help. For health providers in general, integrating some religious and cultural values is also important. So using prayer as a way of coping can be helpful. Using kind of tolerance and forgiveness. So if you're experiencing Islamophobia, you're being discriminated against, you probably can't do anything about that yourself, or something that like you can't, maybe like you're experiencing at work and you can't quit your job. So what are you going to do? So maybe practicing forgiveness and saying that that's something that you're going to live up to God to take care of. So there's also education and communication about drugs. So a lot of the times in the community, there isn't a lot of discussion about drug use because we're expected to not use drugs, not use any kind of substances that might be addictive. So, but from research, we know that it is a reality. There are people who are doing it. Like half of college students that were surveyed reported that they used alcohol within the last year. So it is happening, so we need to communicate about it, we need to talk about it, so only when we talk about it we can really deal with the problem. Also for healthcare providers to assess for substance use, so that goes along with mental health providers and doctors. A lot of the times for people from marginalized communities or minority communities, they will go to see a doctor first, a primary care provider with different types of problems. So that's something that the primary care provider should also look into and ask questions about. One of the treatment programs that's been shown effective is this 12-step program. I think it was first started in Malaysia. Milati Islami, which can integrate, which integrates a lot of Islamic values and has been kind of redesigned for Muslims. I know Dr. Arfkin talked a little bit about it. So that's something you can, for people who are serving Muslim communities, there are large enough clients who can benefit from that to have a 12-step program like that. Also, using our faith leaders, so talking, incorporating things like this in sermons in the masjid, talking about, so even like when you're talking to your, when people are talking to imams, talking about healthcare, talking about different things that might be happening in the community. And communal support as in general. So in right after 9/11, one of the problems that came up was that there was a lot of division within the community. So people couldn't go to each other for support because there were a lot of suspicion of each other, which has gotten better since then. So that's something we also need to keep relying on, is supporting each other. So even if it seems as something negative, like addictive behaviors or drinking and drug use, we don't want to completely like shun them from our group. We need to talk about it and give each other support and work on the problem. And another thing to work on is support groups. So we know from research, people of color and more minoritized groups, they do better in support groups rather than like individual therapy or therapy tribe groups, because of like you're not telling some, like the expert is like the values, it might be different, and from historical context, there have been experts who've exploited people, who told people like completely different things or took advantage of people. So a lot of the times what's been helpful is support groups. So getting together with people who might be experiencing similar problems and talking about it with each other and supporting each other. Other healthy coping strategies you can engage in is, if you can, to disengage from like negative environments. So one of the things, a big thing is social media. So we see a lot of negativity in social media. People attacking each other, people like saying, oh, you're saying this about Muslims, which is not true, and this article says Muslims blew up everything. And so it's like you're constantly exposing yourself to Islamophobia and very negative messages about who you are. So one of the things I did after the election is deactivated my Facebook, and which has done wonders given like all the stress I had to deal with as a PhD student. Like taking that little thing out has been very helpful. Like I mean, I still look at the news and know what's going on, and I want to keep up with it, but like constantly getting that negativity and like people fighting with each other on social media, that can be really good for you just in general, just reducing your anxiety a little bit, or like some depressive symptoms when people, it is depressing. Every time you watch the news and everything sucks, and like what can you do? Sometimes you can't do anything. Also engaging in activism, that can be helpful. I know CARE is doing a much better job right now, mobilizing more, talking more, really going out, making public statements as soon as something happens. On the CARE website, there's like a toolkit for people all in the Muslim community, different ways to get engaged, like working with law enforcement if you need to, talking with each other, having an idea, like kind of a plan about what you can do if you are experiencing racial discrimination or anything with the travel issues, having lawyers in mind, people who you know have been helpful to other Muslims, who you can go to for support, people you trust. Also reporting hate crimes, we know there are certainly more hate crimes happening than we see numbers of. A lot of the times people don't report it, which is understandable why people don't, but it's important to report them because when we talk about like we're experiencing discrimination, it's really important to have the numbers. You can't like deny numbers. So if you're really reporting the numbers and we can say like this is happening, this is like, these are like terrifying numbers that's happening, like people who are being victimized, people who are experiencing harassment or physical violence, we can say that there's proof of that. Also political participation. So there's so much focus on national campaigns and presidential elections, which is important, but we also need to focus on more local issues. So focusing on mayoral races, focusing on state races, like for state senators, representatives, and governors. Like for me, like it's been very surprising to see in the last 10 years. I grew up around Sterling Heights, Detroit suburbs. So like even after 9/11, I didn't see the amount of negativity in Islamophobia as I do now. Like there was like, I think there was a proposed plan for a new mosque to be built, and people were picketing it and protesting it. That like I couldn't have imagined when I was growing up, when I was going to school. Like it's just getting much worse. So, and the mayor of Sterling Heights was actually kind of using that to get more votes and saying that he's going to be the one to keep people away and not let the Muslims take over. And there were issues about signage for the stores, like using Arabic or any other language on the signage, that there might be something like terroristic messages on there. So all of those things we need to be really vigilant about. When we see it, we need to go and participate and go to your local meetings, go to your city hall meetings and complain. File a complaint and talk to your representatives, because the local people probably have a much more impact on your daily life than what Trump does on a national scale. Like, yeah, it does affect people when they're traveling, but you're not traveling every day of the year. But you are facing your neighbors who might be Islamophobic. And that's every day. Some of the other recommendations to think about, just kind of unrelated stuff that I think Dr. Arfkin found that in her research, that where people get treatment. So a lot of the times, because there's so much disapproval of substance use in the Muslim community because it's prohibited in Islam, there's a youth and children, they would try to hide any kind of substance use. So they are more likely to do it not away from their families. So that's also something to consider about locations for treatment centers. Like, we usually think about, when we think about providing services, we want to go where the people are. But in this case, it might be the opposite, that they're less likely to go to this substance abuse treatment center because they don't want to be identified as the person who's using drugs or who's on Suboxone or things like that. So they might want to go to somewhere farther away from their community, so they can feel a little more safer. Also, as a community, and for researchers who are here doing more community-based participatory research, we do a lot of research, we come up with ideas and go to communities, kind of, and we do find good stuff. But another thing we need to do is talk to the community, involve them in our research. When we talk to the community, we know more about what's going on and what people are experiencing in their day-to-day life than we get from just reading our articles or just us watching TV and what we get from that. Talking to each everyday people, we know we might get ideas about research that nobody has ever looked at or we haven't thought about. And it also promotes trust in the community. So what we know from research is often researchers go in communities, kind of use them, we do our publications, and we get our tenures, and then we're done. But with community-based participatory research, you're going to involve community members in the research process. You're going to share what you find in the research after you collect your data and analyze your data, and maybe help them come up with a solution, or like tell them what it is so they can come up with their own solution. So that's another thing to think about. So in general, even though we kind of separate a lot of the social and political things, that has a big impact on us in our everyday life. I know it impacts me when I watch the news, when I hear all this stuff. So that's something we need to also think about for mental health implications and also substance use. Thank you.